You name it. Every field is corrupt in a similar way that orthodontics is corrupt. And to find the truth and to find the healthy path through any subject matter, you really do have to swim upstream. So it is absurd. Again, it's an area where evil is predominating and the truth is being suppressed. But that's kind of how everything is in our world. You know, we're not as enlightened as you might think. When we learn about Copernicus, we're sort of taught that in a frame of like, oh, we're past this. We're so enlightened and scientific now. That is absolutely not the case. There's a lot of darkness in science. And a lot of it is wrapped up as well in financial interest and political interest. There's also that angle to orthodontics too.
Yeah, unfortunately, once you go down this rabbit hole, you can't really see it the same way. So I agree with that.
Yeah, it's good to meet you too, Patrick. And thanks for joining me on this chat. And yeah, what's going on?
Yeah, so just to give you a bit of background, I went through orthodontic treatment ages 11 to 16, got some premolar extractions, braces, 4 premolars gone, classic case. So currently on my journey to kind of reverse that. So I just wanted to kind of talk to you about this, see what your thoughts, your perspectives are, just have a genuine conversation, basically.
Yeah, of course, you got it. And how old are you?
Right now, I just turned 23, so yeah, early 20s.
Mm-hmm. And where are you located?
I am up in Canada, actually. So I am in the capital of Canada, Ottawa. It's a bit northeast from Toronto, which is the most familiar landmark. But I've also, yeah, go on.
No, why don't you go on?
Oh, yeah, for sure. I will also disclaim that I am currently undergoing DNA appliance treatment. I know what your thoughts are on that, but I will kind of guide you through like what I've gone through. So okay. I knew what I was getting into with DNA. I knew there's going to be a lot of teeth tipping, but I thought that was maybe justifiable if it gave me a bit of tongue space. But I understand now that I am progressing towards the end of that treatment. And the next steps I am looking for would be MSE. But I do have some issues with that because there aren't a lot of providers in Canada. So I found one provider. I had one consultation with him, but he seems to be a bit more conservative in his approach, and he's only considering giving MSE from what I can see if there is an objective case of severe sleep apnea, which I don't believe I have. So I'm just wondering, how did you manage to get your provider to provide you the MSE treatment? Because I've been following your journey for a while.
Yeah, it's completely different here in the United States. The providers are not as conservative as they can be in like in England or in Canada. For whatever reason, they will only do MSE for, discrete cases of sleep apnea, or if there's some sort of malocclusion that they think that the MSE will help. In the United States, pretty much if you are visibly small, they'll give you MSE in a lot of cases. I mean, it's not like, I don't think it's at a point where it's being abused, but American doctors seem to think sort of like you and me, where, why not use it if it's going to help to some degree, even if there's not some diagnosable breathing issue or malocclusion. Yeah,
so the issue with my current case is because I have quote-unquote perfect occlusion, which I don't believe that to be true. I have an intermolar width of 29 millimeters. That's when I first started. With DNA, with a bit of teeth flaring, it's gone up to 33 millimeters, which is still definitely not enough from what I can see for my tongue width, for my actual facial structure, posture, everything. So basically, I do want to kind of give you an overview of my treatment. If I can share my screen or something, would that be okay?
Sure. So is that doctor not going to treat you basically unless you take a sleep study?
Well, I already did take a sleep study, and the results of the sleep study were actually I didn't do a sleep study at the hospital. I just did a take-home sleep study, and the results of the sleep study indicate that I don't have any severe form of sleep apnea, which I would actually agree. But I do have a lot of other things, such as low oxygen saturation, and my heart rate suddenly spikes up to 174 beats per minute, occasionally during the sleep because I have no oxygen. But there's no there's no severe objectivity regarding like the amount of sleep apnea adverse events. So that's why I think he was a bit hesitant. So like I was actually considering of going the kind of, let's say, aesthetic route. So instead of convincing my potential provider for that I want to get it because of health reasons, do you think it'd be like a decent argument to make that I want the aesthetic benefits that MSE provides?
No, I would make
Okay.
that a secondary argument, because dentists do not like patients who are seeking primarily aesthetic outcomes. I should say MSE providers don't like that, because a lot of times people are actually unhappy with the way MSE looks.
Yeah, got it.
So the doctor wants to treat you if he thinks he can make you happy. Doctors don't like unhappy, unsatisfied customers. Unsatisfied customers want refunds and follow-up appointments and phone calls to talk about how unhappy they are. Doctors don't want that. They want
Fair
easy
enough.
slam dunk cases, and so it's always better to focus on health.
Okay. Is it okay if I share my screen a bit?
Yes.
Let me see. Yeah, so I actually initially went with the DNA appliance because this was the only possible treatment I could actually get at that time. I didn't even know this possible MSC provider existed near me. But I will say that my provider was actually very thorough with her diagnoses and stuff. So I had to fill a bunch of these forms regarding possible symptoms. She also did a full analysis of my bite, my occlusion. Something was really cool was a postural test. So basically, she did a bite registration test with posture. So basically, my resting jaw, my lower jaw, is actually back. So what she did was she made me stick my right arm out like this, and then she tried to push it down. And there was a very big strength discrepancy when my occlusion was at its rest and when I moved my jaw forward. So basically, she concluded that my jaw should be a bit more forward because it does give some postural strength when she did her test. Like, I'm not sure if you've ever heard of something like that, but that was the first
I have.
time.
I've seen it done.
Oh, really? Okay.
I've had it done to me. Yeah. Mm-hmm.
Okay, because that was the first time I've actually seen it, and whenever I tried to mention it to any other dentist, they were like, "Yo, that's just quackery. It's like pseudoscience." So that's also a dilemma I've been facing. Is a lot of the providers in Canada are very, very conservative, and they kind of have a dogmatic way of looking at everything. But to keep going on, this is all the forms, and then what is beneficial is that they did do a digital scan. They did.
Is that your maxilla right there?
Yep, that's my maxilla.
It's narrow as fuck.
I know, and every dentist I've gone to, they're like, "Yo, it's genetic. Your teeth extractions were justified. Your maxilla is not narrow at all," and it drives me crazy because I know for a fact that it is insanely narrow. So that's why
a textbook high vaulted palate.
Oh yeah, and they keep saying it's normal, so it actually is really, really annoying. My DNA provider was the only provider that actually told me that, yo, your maxilla is pretty bad. You have a very big palatal width discrepancy, and this causes a bunch of issues. For one, sometimes I stumble over my words, not because I can't actually I can't physically enunciate the words because my tongue doesn't have enough space, if you understand what I mean. But a lot of people really don't because they have never had a narrow palate, but it makes speech articulation really hard because there physically isn't just enough space to move your tongue around and create the sounds. So yeah, this is the report. We did a full CBTC scan, and yeah, there's a bunch of angle measurements that I don't know how to fully analyze. But yeah, this was my CBTC scan for the actual intermolar width. I'll actually want to show you something. I want to see your analysis on that later. But this is like kind of the report that the DNA provider kind of gave me, and I thought that was actually pretty beneficial. So like, so far, what are your thoughts on that?
Yeah, DNA providers are usually fantastic at diagnosing. So are AGA providers. All the airway-focused general dentists are fantastic at diagnosing and understanding what the problem is. Where they come up short is in their solution. So I have no doubt that her diagnosis was spot on, and there's value to that. It's like the Communist Manifesto, where the first so many chapters of that book are actually pretty good. Like they really get the diagnosis of things pretty accurate, but then it's the solution, which, you know, in the case of the Communist Manifesto is communism. That's where the problem comes in, is in the prescription.
Yeah.
So, but you look like a textbook case.
Yeah. So like would you think that like MSE would be beneficial to my case as well? Like,
yeah, of course.
Okay.
I mean, anything you can do to widen that high vaulted palate. My concern for you is whether or not you can even get an MSE into that high vaulted palate.
Yeah, so like I've actually cross-analyzed a bunch of cases, and there were cases where their vaulted palates were even worse than mine, and they did manage to get the MSE fit in. I would actually say that the palatal vault is slightly wider now after DNA because of some alveolar bending, however much that is, just based on my like what I can see. But like the problem I've seen with MSE is after like a certain age, it does get very difficult to split the suture. Am I correct?
It gets harder the older you get. Correct.
Yeah. So that's why like I want to get this treatment as soon as possible, because right now I'm 23. I think my bone structure is still decently malleable. But yeah, the issue I'm having right now is it's just hard as fuck to get a provider in Canada. So worst case, I might have just have to go to the States. But I want to get your input on like this next kind of set of images that I'm going to show you. But like,
sure,
you can see like right now what I'm showing, right? So this is like a CBT scan. And what I'm noticing just off of my eyes is that the two on the left, their dental alveolar processes on the upper and lower arches are parallel. And as you can see, mine are not. So like what I'm thinking in my mind that MSE can be used to expand my upper arch, and then some teeth tipping could be used to expand the lower arch. Like, what are your thoughts on that?
That's pretty routine. That is usually the way it goes. It's very rare to have skeletal expansion of the mandible. There's not too many people doing it. There is someone in Canada who does do it, though, up in sort of roughly your neck of the woods. But yeah, otherwise, your only option is to do skeletal expansion of the upper and then dental expansion of the lower.
Yeah. Do you happen to know the name of the person in Canada that does provide it, or no?
Sylvain Chamberlain?
Yeah, so I have heard of Sylvain Chamberlain. But he's pretty far. He's all the way like up in Quebec, which is pretty far from where I'm from. My provider, go on.
Yeah, would that be more logistically challenging than just coming to the United States?
I wouldn't say necessarily, because I may be moving to the States later on sometime next year or the year after, but I'm not sure about the timeline yet. So, like worst case, I'll just get the treatment there. But I do not want to delay this too long, because I do know it does get exponentially harder and harder to.
I don't know if it gets exponentially harder, but it does get harder.
Okay,
but,
got it.
You know, with some of the new surgical assist techniques that they're using, like the piezoelectric knife, the success rate with splitting adult men is approaching 100%. So, like, you're kind of okay. Like, I would not feel that sort of frantic sense of urgency about like, oh my God, I need to do it now or else I'll never split. I would say you're going to be okay no matter what, as long as you can have the right procedure done to assist it.
Got it. Yeah, because I did talk to Dr. Lipkin as well, which I know is your provider, and he did say that my upper arch is very narrow compared to my lower. So that gave me a bit of reassurance, because I talked to him like a few days ago. But like I want to get to this case, which I saw you mention in one of your videos, right?
Yes.
This is part of the this is from a post in the MSE user group. Am I correct?
Correct.
Yeah. So like I'm wondering like after this, could you maybe like provide me some more of these images? I want to maybe show them to my potential provider because I have an appointment with him tomorrow. These images and see what he thinks. Do you think that'd be a good idea? Just to provide him some cases.
Well, yes. Are you interested in doing a face mask for yourself? Is that something that's on your agenda?
I actually do have a face mask with me right now for my DNA appliance because they did recommend using the face mask, but they actually give you this crappy one first. You've seen it. So yeah. I ended up getting a bow, and I used that.
Oh, nice.
I modified it so it's actually easier to sleep with. I have no problems using a face mask. I've been pretty accustomed to it. So I would be willing to use a face mask, yes.
Yeah, are you you're not a class 3 though, are you?
No, I'm a class 1, but
So you're just doing it just to bring everything forward, or do you have the sense that your lower jaw is retruded?
Yeah, my lower jaw is retruded.
It's not visible in the bite.
Mm-hmm. Yeah, I have a sense that my lower jaw is retruded because like my DNA appliance, I have it right here actually. When I actually put it in, what it does is it actually moves my lower jaw forward. It has like a bite plane to like move my jaw forward. And let's say every day without wearing my DNA appliance, I have a lot of neck tension, for example, because I can't maintain proper tongue posture. I just don't have the space. So what the DNA appliance does help is it does bring my jaw forward, and it does allow for me to create more pressure with my tongue. And then that does relieve a bit of the actual tension in my neck. But I know for a fact that this is just kind of a Band-Aid, a patch. And it's not really a long-term permanent solution, which is why I'm looking further down this route of MSE.
Sure. And have you had any results with the face mask that you're aware of?
No like actual aesthetic benefits, but I do notice when I wear it with the elastics, it does make it easier to breathe when I sleep. So it's a lot easier to nasal breathe with the face mask. My theory is that it kind of stretches the airway or whatever, but it does make it slightly easier to breathe nasally because my nasal breathing is really messed up.
That's interesting. I've never heard anyone say that the face mask helps them breathe, but I think it's fascinating.
Yeah, because I'm a bit aggressive with the face mask. Like my DNA provider recommended me to use 2 elastics, 1 for each side. I kind of maxed it out. I used 3, and it's not that much pressure, in my opinion, but like it doesn't hurt. But like you feel the pressure more, and it does make it a lot easier to breathe. So my sleeping has been crazy, crazy good after I use the face mask. I used the SnoreLab app before DNA. I know my tongue just fell into the roof, and fell into my throat, and then my sleep score for snoring was crazy. After using DNA, I understand that it actually allows the tongue to actually suction up against the appliance itself. And I don't snore when I sleep anymore with the DNA appliance. So it does provide benefits for sleeping, but in terms of actual structural changes, I don't think it can do what I need it to do.
Understood.
But yeah, I'm going on to the rest of the slide. I kind of prepared this in advance. But yeah, so this was like my understanding of what my treatment should be. I just want to get your opinions on that. So like an MSE to expand the upper arch, face mask hooks with the MSE to promote the forward growth, and then something to tip the lower teeth. I think that was pretty clear. And then
high racks appliance.
Yeah. And I want to discuss a bit my symptoms as well. So like, I understand you've done a lot of these talks. I'm wondering if any of these like ring some bells or anything. But first, my facial structure, I would say, is decently poor. No cheekbone definition, long mid-face, gonial angles high, no jawline, regression, the upper and lower jaws, TMJ. So my question is, since you've undergone the MSE, do you think there have been some aesthetic benefits?
For me, yes, I think so. I think that it made my zygomas more prominent.
Got you. Yeah. I did read some papers regarding that.
And what did they What did they say?
Yeah, they basically conclude the same thing, that there was roughly on average a 2 millimeter increase in the zygomatic arches for the left and right side. Yeah, it's like the research is there, but like whenever I try to mention it, they like a lot of providers, they just say that there's no literature regarding actual palatal expansion in adults, and the only solution is surgery. But
Right.
yeah, onwards. My mouth, as you can see, I have a high arch narrow palate. Tongue is too large, obstructing my airway, and I did mention the speech difficulties. So like certain sequences of words are harder for me to say, and I will stumble upon my words just because I physically can't say them. So I'm wondering if you had any speech benefits with the MSE appliance.
It's hard for me to say just because I've basically constantly had metal in my mouth since that time. So it's hard for me to know where zero is for me. I haven't had a lot of consistency in what's happening in my mouth since I did MSE. In general, I would say I have had some change, and that change is positive. I feel like I have more wind overall. I feel like I have a bigger mouth that I can use to make more sounds. People tell me my voice is different. However, presently, it's hard for me to kind of say that with any enthusiasm or with any conviction just because I have lingual braces and TADs on the roof of my mouth, and my speech right now is pretty uncomfortable. So, like, I'm not exactly, shouting from the hilltops about how easy and pleasurable it is for me to speak.
Yeah. Also, you've undergone extractions too, am I correct?
Yes. I call them amputations, but yes, I had 8.
Yeah, I call them mutilations. But after MSE treatment, I'm assuming there's a lot of space on your upper arch. So like I'm wondering, are you planning on getting any implants afterwards, or no?
I'm not planning on getting any implants because my spaces have been closed.
Oh, they have. Okay. Yeah.
Oh yeah. Yeah, and I think in general, people don't tend to get implants following MSE. Generally, the diastema is closed by just bringing all the teeth up and forward.
Okay, so you pull the teeth forward. Got it. Okay.
Basically, yeah.
And before MSE, do you think you had like very grand difficulties with nose breathing? And when you do breathe with your nose, do you get like lightheaded? Because like that's my main cause for wanting to get MSE, because I realized my airway is pretty narrow, and just breathing through my nose every day is a very big difficulty. Like, I would say I'm decently athletic. I go to the gym, I do kickboxing, do bouldering, but I know my ability is very hindered because I can't actually effectively breathe. And when I try to actually breathe with my nose, I always get lightheaded, dizzy, brain fog, and I just feel like I'm about to faint. What I did notice, though, is when I actually physically expanded my nostrils with one of these appliances, pretty unorthodox, but it does let me physically get more airway volume in my nose. So, like, I'm wondering, have you ever encountered something like this? Or, like, if in the past your breathing was really obstructed, then MSE just cleared it like crazy?
Yes, the answer to that is yes. If your primary complaint going into MSE is that you want better nasal breathing, based on my experience and my results, you will be very happy with MSE. It's a very humble goal to have with MSE, is to just be able to breathe better through your nose. And physically, that's exactly what MSE does, is it increases the basal bone in the nose. Yeah. Before MSE, I was perpetually clogged in my left nostril, and I could halfway breathe through my right. Sometimes yes, sometimes no. After MSE, I can always breathe through my left nostril, and my right nostril is still hit or miss. So the MSE blew open my left nostril. Before MSE, I was constantly experimenting with nasal dilators and nasal strips. I have YouTube videos pre-MSE YouTube videos where I'm messing around with nasal dilators and nasal strips. When I was in my post-bac pre-med program, I would wear nasal dilators and nasal strips to my exams, and everyone thought I was a freak. They were like, "What are you doing?" I'm like, "Guys, this is just like a football game. Like, look at the linebackers. They're wearing nasal strips. It's the same thing. I want to breathe better to improve performance." And they always helped me. They did. I think they're great. I think they're a really great diagnostic tool and also a really good crutch to use prior to MSE treatment. And generally, I would say if a nasal dilator or a nasal strip helps you, then so will MSE.
Yeah, I got it. That was my chief kind of concern or question. Also for posture, did you find you had like a lot of like neck tension before MSE, or like have you spoken to people who had have a lot of neck tension? Because I understand that like I did have forward neck posture. I'm trying to actually lessen it, but it's still so hard structurally because I can't mute and I can't maintain the posture to do that.
Yeah. Yeah, of course, the whole way that I came to JawHacks and the way that I started this channel was because I had occipital neuralgia, which is a chronic neck pain condition.
Yeah.
And my hypothesis is that I arrived at having that chronic neck pain because I had a small airway, which caused me to have chin forward posture my whole life. And that posture causes you to be weak in that area, and then you become subject to micro trauma, micro injury in that area anytime you go over a bump in the road or play a sport or sprint, or anytime you do anything. Basically, your neck gets a little bit of abuse because it's not being held in a natural way with integrity. So my whole goal with expanding my jaws was never anything but fixing my neck posture and improving my headaches. And I would say on that front, I have been partially successful.
Got you. Yeah,
I would say I am definitely better, and I would not take back my expansion for anything, because right now my headaches are better than they've ever been. And whatever role expansion played in that, I wouldn't want to find out how significant that role actually was. But my neck is not perfect, nor is my head posture, but that's just because my jaws aren't perfect.
Yeah, gotcha.
I do fantasize about how double jaw surgery would be yet another step forward in the direction of perfecting neck posture, because I'm still a little bit chin forward, just because in the AP I'm lacking.
Yeah, got it.
MSE only does so much in the AP direction, but you're going in on Facemask, and so hey, maybe you'll get there. Maybe
is there a reason you didn't do Facemask besides like it being uncomfortable?
I just didn't have faith that it was gonna get me to where I wanted to go. Because I had this idea, and to some degree I still have this idea, that when you pull the maxilla forward into nothing, like if you're not a class 3 where your lower teeth can then serve as an anchor for your maxilla once it's dragged forward, right? Then I envision that anytime I take the face mask off, the maxilla is just sort of reverting back to its original position. And so that idea, whether it's true or not, combined with the discomfort and the inconvenience of the face mask, and I was just like, fuck it.
Yeah. So like these treatment cases that I'm going to show you is like, these were what I was planning on showing to my provider to kind of give him overview about the effectiveness I've seen of like MSE. So this is like cases from Dr. Mariana Evans, the full expansion of the maxilla here. And then this is CBTC scans. And then this is the Dr. Lipton case that you showed in your videos. So like, you think it's a good idea to like show my potential provider all these images, or like what should I go and tell the provider to kind of have the most optimal chance of like potentially getting the treatment? Because I would rather get it first in Canada because I'm insured and everything, and it'd just be a big cost saving. But I just want to get your thoughts on that.
So I never really advocate really kissing up to doctors and convincing them to treat you. I think that it's hard enough to get treated by a doctor who's enthusiastic about treating you and optimistic about them giving you a good result. So in general, I wouldn't do what you're doing. I would just find another way to get treated by someone who wanted to treat me. But that being said, I think any reasonable MSE provider should be aware that sleep disordered breathing exists on a spectrum, and it's not black and white. It's not either sleep apnea or perfect breathing. And if you could demonstrate that And he should know just by looking at you and that high vaulted palate that you probably fall somewhere on the spectrum. I would really focus in on that and say, hey, look, maybe bring in some snore lab results, maybe bring in results from a sleep study that show some amount of UARS.
Yeah.
And say, hey, look, I'm not looking for a perfect result. I'm just looking for an improvement in my nasal breathing. Here, listen, and then show him how your nose is blocked, and then just rely on his power of reason to know that the MSE is going to widen the nose. It's going to improve the airway in several different ways. And if that doesn't convince him to treat you, then it's time to move on.
Yeah, got it. I actually didn't think about it from that angle, providing the actual snore lab results. That's good. Because I understand that a lot of these dentists, orthodontists, providers, whatever, they rely a lot on quote unquote like objective data. Like I don't see like the problem with that, but that's why I kind of want to move into this next topic though, of why do all these educated providers, all these dentists, orthodontists, why do they believe that crooked teeth is genetic? Because all 5 of the providers, or the dentists, I should say, that I've talked to in my city, they've all told me that my crooked teeth was genetic, and I just see that as bullshit straight up.
Yeah, I think that's what they're taught in school. And, doctors and anyone going through an American or a Western healthcare system are basically, they're not really taught to think for themselves. I guess in the context of research they are, but not really. Even when they're doing research, they're doing it out of fear, in fear of the publication houses rejecting their work, and they're sort of catering everything to have better chance at being published. Everything they do is like, to become a doctor, you basically have to kiss ass of whoever is next in the process of like whoever is the next gatekeeper. Whether it's the admissions committee, or whether it's the residential admission committee, or whether it's your research advisor, or whether it's your boss at the hospital, everyone is just not thinking for themselves, and everyone is just plotting to appease the next gatekeeper. And that type of lifestyle is not entrepreneurial, right? It's the antithesis of entrepreneurship. Entrepreneurs are actual real problem solvers. They know that they're out there confronting material reality, and that if they don't bring value, they're going to fail. No one is going to pay them. They can't rely on some hospital hiring them just because they have some degree. And so entrepreneurs, people like you and I who have problems, and we're trying to solve those problems, and objective reality is the ultimate determinant of whether or not we fail or succeed. It's not like that in medicine. In medicine, it's just you learn from textbooks, you kiss ass to your supervisors and your superiors, and they're told that malocclusion is genetic, and you don't question things when you're going through med school.
Yeah, that's why I find the problem to be, because it's kind of, in my eyes, it's kind of like a pseudo-religious way of thinking, like kind of like what's happening to like Mike Mew right now. So like you get these orthodontists and dentists in the UK who are saying that his argument is flawed because crooked teeth are genetic. But like the way I look at it is like, if you took them in the 1500s and they were astronomers, they would have lynched and willingly lynched Copernicus for like stating the heliocentric model. So like that's how I kind of see it. It's kind of a dogmatic religious approach to it, which is kind of sad really, because it's kind of contradictory, because they advocate for scientific integrity, but they're not willing to entertain perspectives that don't conform to their worldview.
You're absolutely right. And if you think that we are past the era where you could be burnt at the stake for having an ignorant we're not as enlightened as you might think.
Yeah.
When we learn about Copernicus, we're sort of taught that in a frame of like, oh, we're past this. We're so enlightened and scientific now. That is absolutely not the case. There's a lot of darkness in science.
Yeah, I fully agree. Mm-hmm.
And a lot of it is wrapped up as well in financial interest and political interest. There's also that angle to orthodontics too.
Yeah, unfortunately, once you go down this rabbit hole, you can't really see it the same way. So I agree with that. But like this is what I've also like tried to reason. But humans are the only like I'll narrow it down to mammals. Humans are the only mammals like in existence to have malocclusion. So like I don't see how. Well, we did mention that because they're taught not to think, but like no self-respecting evolutionary biologist or anthropologist would make the claim that crooked teeth are genetic, because like even 500 years ago, not a lot of jaws had crooked teeth. It shows in the records, but why trust them when you can trust dentists? Am I right? Because they obviously know the development of human biology.
I agree with you, and I think it's absurd that our intellectual elite is so willing to entertain evolutionary theory when it comes to any other facet of academic understanding in science, but when it comes to occlusion, it's like all of a sudden we have our horse blinders on to evolutionary approaches to understanding. It's absurd.
Yeah, it's really annoying because, these days everyone advocates for science, but when it actually comes to the philosophy of the scientific method, no one's willing to entertain it. They just say trust the science or whatever, and you just blindly believe it. But that's a form of religious dogmatism, from what I can see. So
I don't know how much people are really interested in science in so much as they are interested in weaponizing science to advance their own agenda.
Yeah, agreed.
Science is like science with a capital S is a magic wand they want to wave over conversations to say, no, I'm right, you're wrong.
Yeah, I see it being weaponized. Whenever you just provide an argument they don't like, they'll just say science proves it otherwise or something like that, some bullshit explanation.
Correct. Yeah. Completely agree.
So like, this gets me to like another point, but like, do you find it kind of disturbing that so many people like us have been affected by orthodontics, by negligence of the actual origins of crooked teeth, which are not genetic, but cause of bad orofacial habits, lack of chewing, etc., but are intentionally, I would say, misled into believing otherwise? Like, I find that just kind of so disturbing and kind of sad.
It is disturbing and it is sad, but I guess I'm jaded at this point, maybe because I've been red pilled and based on so many other topics throughout my life. I'm 32 now, and it's really like this in every other field as well, in politics, in nutrition, in fitness, in mental health, in dating, in drugs and alcohol, in media, you name it. Every field is corrupt in a similar way that orthodontics is corrupt. And to find the truth and to find the healthy path through any subject matter, you really do have to swim upstream. So it is absurd. Again, it's an area where evil is predominating and the truth is being suppressed. But that's kind of how everything is in our world.
Yeah, agreed. Yeah, it's an unfortunate reality of that. But like with JawHacks, I'm just curious, like directly with you, like what is your, let's say, ultimate goal for JawHacks?
Oh gosh, I mean, my goal with JawHacks is just to make sure that the lessons I've learned in my journey are not squandered and forgotten by posterity, because I've suffered too much from learning the hard way through my own actual experiences with my own treatments. I don't want people to have to learn the hard way that I did, and so I made this channel so I could simply communicate the very simple lessons that I learned. For example, about the differences between tooth-borne and bone-borne expansion is a huge topic on my channel, and other very specific lessons I've learned as part of my own journey to get expanded. But yeah, at this point, my goal with JawHacks is, apart from providing a little bit of income for myself, because that never hurts, I just want to help as many individuals as I can to live better lives. I feel for the plight of young men in particular, especially young men with craniofacial dystrophy who have been mutilated by orthodontists in their youth. And I want to be a resource to help them make their lives better.
Got it. Because the reason I was asking that is because eventually I do want to go a route similar to yours. But like I understand people believe what they see, not what they hear, which is why I do want to get the treatment, see, analyze, observe the results, and then start, like you, just one day creating content and trying to spread this message to as many people as possible. So yeah, that's kind of why I asked the question.
Sure. And I think that would be that's a noble goal of yours, and I will support you in any way that I can. I can tell that you're very articulate and that you'll be a very effective communicator in this space if you just, take the plunge. YouTube is very arduous. It's hard to rack up subscribers. I've been doing this for almost 5 years, and I'm still not even at 10,000. Not that racking up subscribers is the goal. It can just be hard to publish videos into a void. So you really have to do it intrinsically. Like the content has to be intrinsically interesting for you to make, and you have to just be documenting your own interests basically in order for you to have enough nourishment to get you through those dark days where you don't have any subscribers.
Yeah. So like, I'm curious from like, what are your thoughts on, let's say, like moving some of your content onto TikTok? Because as bad as it is as a platform, it is unfortunately one of the best ways to reach a large scale of people, especially younger audiences who would benefit the most from hearing these words of advice.
I'm totally open to it. I don't use TikTok, and I have a hard time just uploading to my own channel. Curating content is a brutally tedious process that I don't really enjoy. I also have another job, but I am well aware of how much opportunity I am missing by not taking advantage of the current growth curve of TikTok and also even just YouTube Shorts. YouTube is super incentivizing Shorts right now, and I've never even done a single one. If only there were two of me, or if only I didn't have another job and so many individuals who were like dependent on me for various things. In my other business, I have over 400 tax clients, and each one of them, in any given day, a handful of them will pester you for something. And so I'm just constantly being ripped in a million different directions. But if I could just focus all my energies on JawHacks, I swear I would take full advantage of TikTok and YouTube Shorts and Instagram Reels. I have a limited capacity as to what I can do, and I'm not really capable of pushing myself in freakish ways because I still do suffer from a chronic headache condition, and I have to sort of dance around that. I really have to live a moderate life. I have to balance work and fitness and my social life and my girlfriend and my diet and my relaxation, my spiritual life. It's all existing in balance right now. And I can't just go 12 hours a day on JawHacks.
Yeah, I get that. The reason I was like kind of leading there is because I personally think you are one of like the pioneers, I would say, in this kind of space and bringing awareness to the space. So, if you were to do that, if you ever need some help with actual like editing content or anything like that, would you be like possibly open to that? Like maybe not now because I understand your life is busy, but like sometime in the future, would that be like a...
Yeah, like of course. Like you want to help me edit content?
Yeah, possibly sometime in the future. Yeah, I would be willing.
Of course, I would love that. Like for example, what would you imagine would be? Could you imagine a way of taking up these chats and chopping them up for TikTok? Would it have to be?
Yeah, go on.
Or would it have to be like content created specifically for the TikTok style?
The content created specifically more for the TikTok style is a lot more effective, I would say. These types of clips, because TikTok people have a very short attention span. So they don't really want to kind of go through, let's say, an articulate piece of video and actually have to kind of deeply think into what we're saying. They just want like a quick burst of words. And then after they get hooked on, then they'll follow on to the articulate content. So the reason I was actually kind of asking that of you as well is because I've made a lot of, let's say, scripts for TikTok that I could potentially use in the future. And like, if you'd be willing to like maybe do like maybe a clip a week or something just to get started, I would be willing to curate that.
Well, that's a very generous offer, and I'll tell you what, I will I will consider it very strongly after we get off this call. I might download TikTok right after we get off this call and see what it's all about.
Yeah. Because, yeah, I just want to kind of get this message to as many people as possible, because every day, like in my daily life as well, like the amount of people who like, I'll just casually mention this, like, have you ever thought of like crooked teeth and like the causes of it? And then almost everyone says it's genetic, or like their orthodontist told them that their father had like a small jaw and their mother had big teeth, which is a bullshit explanation. And then that's why they have crooked teeth. It's crazy.
Right. Yeah, people have not thought deeply into this stuff, not at all.
Yeah, it's sad because there's just too many distractions, and it does really affect your attention span. Like, personally, I've been a victim to that as well. So I understand why people aren't willing to invest energy into researching this stuff, because it is very tiring, it's very lonely, and yeah, it's tough.
You know, for what it's worth, though, pretty much everyone stands to benefit from the types of, you know, habits that we try to develop in this space and the types of treatments and therapies we try to pursue. There's not a lot of people out there not suffering from some degree of having small jaws and problems related to that. What I would really like to see is prevention. I want to see more prevention in the younger generation. I want to see more. I want to really speak to parents with kids who have 2-3-year-old kids who are going to be seeing the orthodontist for the first time in a couple of years, and doing whatever I can to encourage those parents to seek some sort of expansive therapy rather than, you know, amputation of their kids' teeth.
Yeah, in an ideal world, I wish it were that easy, but the unfortunate reality is a lot of parents are just, they're busy with their lives and they don't have enough time to actually even understand what we're saying. For example, like my own parents, I can convince them all day, but at the end of the day, they'll still believe an expert over me, even though I believe my arguments are very sound regarding this. I'm not qualified, so yeah, it's tough for parents because I just think they don't have time. They're just busy, just trying to get through life, provide for their kids, provide for their family, and yeah. So like, in my opinion, while that's the ideal goal, my goals personally are just to provide insight to this upcoming generation, so that when they're older, they themselves can do the prevention that you're so describing, because frankly, parents don't really use these social media platforms.
Right, so you want to reach people before they become parents.
Yeah, so that's what I'd say my goal would be, just to start as early as possible. And then it's mainly to plant seeds of doubt in this next generation so that they can kind of start to ask the questions like, why don't cats have crooked teeth? Why don't dogs have crooked teeth? Why do humans snore? Like James Nestor, for example, like I think he did a decent job of popularizing that with the adult population, but I think it's more beneficial to kind of start with the growing young generation right now.
Yeah, I'm with you. I'm on board.
Yeah, so that's also why I kind of want to start my MSE treatment. Like I wouldn't say I'm a rush to start it, but I do want to start creating content. And unfortunately, TikTok is very superficial. They want to see results. They don't want to see talk. So that's why I was kind of asking you, because like maybe we could start off a video with your before and after MSE treatment, like if I would have your consent for that, and then kind of seeing them what like even young adults, like it'd be good, in my opinion, it'd be good to reach them as an audience, to kind of get them to know that even though they're young adults and they have a recessed narrow jaw or whatever, breathing problems, there is still a time frame where you can find a possible solution.
Yeah, I'm totally open to collaborating with you in whatever way that you think is right. You just, contact me after this and let me know what I can do to help. You're saying you're going to upload to your own TikTok channel. Do you have an active TikTok channel where you've already uploaded content in this genre?
I have an active TikTok channel, but I have not uploaded content in this genre. But I am familiar with the platform to know how to do it.
Sure.
Yeah.
Well, just let me know what I can do to help.
Yeah, for sure. I'll definitely be in contact after this. Just slow steps. Just I can show you like some of like my scripts and whatever, and maybe we can go from there. But yeah, I'm in no rush for this. This is just like an idea I'd like to propose for you and see what you thought of that.
Okay, perfect. Thank you for that.
Yeah. But like besides that, I don't really have anything pressing to talk about.
Sure. Well, we've covered a lot, and I guess there's more I would like to talk to you about.
Yeah.
I want to hear more about your interest in this space, and you're like a see, I'm a part of an older generation, right? Like I'm 32, and you said you were how old again, Patrick?
Just turned 23.
Yeah, so you're like a diplomat arriving to me from the younger generation that understands things that I don't. So to see how motivated you are about this subject matter is super inspirational to me. And if I'm being honest, most of the people I talk to are about your age. And I can't tell you how, everyone is telling me about TikTok, and I just feel like there's a golden opportunity to go out there and make an impact, and that's kind of what you've reinforced.
Yeah, because the audience in TikTok is because I've analyzed it with YouTube Shorts and even with like Instagram Reels. It's just not as effective because you require a huge following already to have your content, let's say, be readily available to consumers. So TikTok does eliminate some of the barriers for that, which is why you also you had what's his name, Bailey, if I'm correct with his name. He was a
Bailey.
TikToker, right? Yeah, so like
Yes.
like I'm hoping one day like I'd be able to maybe talk with him, see what he thinks of this. Like, has he mentioned like creating TikTok, for example, regarding this field? Because I've seen like his TikTok videos and like they are because he's a musician, right? So he's trying to promote that. So like I'm wondering like if maybe I could get in contact with him. I'd maybe like to talk with him regarding this as well, and like maybe together we can create some sort of kind of TikTok platform for these type of things because it's not a thing yet.
Yeah, right. I can definitely put you in touch with Bailey by email. I can do that, later this week.
Yeah, got it. Mm-hmm.
Does that sound good?
Yep.
Yeah, Bailey's already established in TikTok for sure.
Yeah, so like that would save a lot of kind of logistics because he definitely knows how that platform works a lot better than I ever could. So it would be like a beneficial thing to have kind of his insight, his experience regarding that.
Yeah, and Bailey is super passionate about this space as well. I mean, you saw the interview I did with him. He is a man on a mission.
Yeah, I hope to be like him one day as well because I'd say our missions are kind of aligned. I hope one day I can play my part in kind of changing, reforming orthodontics in a way that like people will realize what's good, what's not, what are the root causes of these issues, and just to reach out to as many people as possible regarding this because I think it's a very, very, very subvert, underlooked field that everyone's impacted by, but no one really thinks about.
Yeah, I couldn't agree more. And I'm totally with you. Yeah, you're preaching truth right now. You're spitting some serious fire.
Yeah, I appreciate that. But yeah, that's all I have to say regarding that.
Good deal. All right, Patrick. Well, why don't we wrap it up then?
Mm-hmm.
And you and I will be following up shortly about some things about TikTok and putting you in touch with Bailey. And yeah, that was good. I really appreciate the energy you brought. You've motivated me personally to look seriously into TikTok. I'm going to do that. And I hope we get a chance to work together in the future.
Yeah, same goes for me. Do you want to reach out to me first with email, or do you want me to like kind of start one off with you?
Send me an email and prompt me for the things that the steps you want to take once we finish up with this call.
Yeah, got it. Yeah, sounds good.
Okay. All right, Patrick. I will talk to you soon. And, thanks again for joining me on JawHacks.
Yeah, thanks for your time, Ronald. Really appreciate it.
Okay, take care, Patrick.
Yeah, you too. Cheers.
Bye-bye.